All right, good evening, everybody. Thank you. Welcome to NextCore. My name is Jim Sinal, and for those who aren't familiar with NextCore, we're a nonprofit organization. Our mission is to help entrepreneurs launch new companies, help establish businesses, grow their operations, ultimately trying to create more companies, more jobs here in the community. And we are today in our still new, I call it, startup incubator, which opened in 2018, and we're currently supporting 50 different startup companies out of this space. So trying to help drive more tech and innovation here in the Rochester community. And we're excited today to talk a little bit about a new innovation, a new technology that's rolling out all over the place, which is 5G. And we've got three great panelists here today that are going to talk about not only the technology and the capabilities, but some of the use cases and application areas and what 5G really can mean, not only for industries, but maybe even for regions like Rochester, New York. So we're excited to hear what they have to say, and we thank them all for being here and for imparting their wisdom on all of us tonight. So the format for today is going to be, I'm going to introduce each of them individually. They're going to get up and give about 10 minutes presentation on their particular area of expertise. And then when all three of them are done, we'll invite them all up here for Q&A, and we can open that up for folks. So if that sounds okay, we'll go ahead and get started without further ado. So the first presenter and panelist that I want to introduce is Osmond D'Souza, who's a principal architect at AT&T. So he knows a little bit about AT&T's 5G activities. He's a data networking veteran. His roles have spanned design, engineering, and business development. As a principal architect at AT&T, he's immersed in leading enterprise accounts to craft mobility and software-defined networking solutions to help them transform their businesses. So he's been around 5G and business applications and all kinds of things. We had a really interesting discussion earlier today about some of the capabilities of 5G, what that actually means. So without further ado, we welcome Osmond up to give a little presentation.
Hello, everyone. Thank you. I'm happy to be here to talk about 5G, what it means, and what does it have in store for us? How do we leverage it to benefit the community, benefit our businesses, benefit our technologies? Go to my, what do I point this at? Maybe there.
Hopefully you have a computer.
The computer.
Yeah, we'll share it out. There we go.
Excellent. Okay. So yeah, we know this already, and this is half my presentation. It really is. Most of this is to remind us, and in fact, more questions are going to come up as we kind of go down this path. Right? And the first question that we get is this real? Is it hype? Is it, what should I do? And it's hard to point to reality, right? When you're talking about wireless, it's there. It's 5G. So what is 5G? Where did it come from? Was it just the next thing after 4G? In some sense, it was, right? 4G was built to be the first kind of end-to-end purely packet data transport for wireless networks. Right? It was designed to be IP-based. Previously, in a sense, your phone was like a modem. That's essentially what it was. It was transmitting and transferring data that was originally analog. Right? So 4G was built to be that, and it gave us the cloud. Because the moment you could start doing IP on your phone, you were not tethered anywhere. And now, whoever you were talking to, wherever you were going to, this device was just a conduit. It was a microphone, as it were. You had to, and since this was mobile, you needed a cloud. The cloud was inevitable once we started using 4G. Right? And so that's where 5G started. It was built starting in the cloud. all the assumptions, all the basics, all the tenets, all the all of this was cloud-based. So you'll see not headlines, you'll see descriptors somewhere, saying built in the cloud, originated in the cloud, but that's what it was. The basic constructs were cloud-based. Right? So what do we do? What do you do? Well, you hear it's higher capacity, right? It's higher data rates. It's high device connectivity, and it's low latency. I think those middle two, I don't know if they're surprises. It's not intended to be, but they may be unexpected. What does low latency have to do with anything? Why is it such a big deal? What about device connectivity? Why is that such a big deal? The keys here are that with high connectivity, you can have in a small area a large number of devices, not just thousands, but millions of devices per square mile. It gives every device in a city-type environment a voice. That's essentially what it is. You can monitor the device, you can put a sensor on it. If you have 1 million devices that you can talk to within a square mile, it suddenly brings that square mile to life. There's a conversation to have with that. It's giving you information. It's got a heartbeat. You can monitor it. It can tell you something about what it's connected to. It's what we need to enable smarter cities, not just smart cities, because smart cities are a fact of life now. You've got people who can do, utility companies can monitor the electric distribution and water pumps and all kinds of things, detect leaks. Right? This makes them smarter because you can now enable, again, a heartbeat, a dial tone, a voice on almost any device. Right? And it might seem like the device needs to be an electronic thing, something that you plug in somewhere. Actually, there have been strides in other associated technologies, in material sciences and other things that have enabled new types of sensors, right? That somehow do their own magic, as it were, to have that voice, right? You've got devices that are made of piezoelectric crystals. And all that happens is that they're attached to a source that applies pressure on that, and it lets off a small signal because that's what piezoelectric devices do, right? You squeeze them, they emit an electrical pulse. So for instance, you could put a piezoelectrical coating on let's say, a syringe. And the moment that syringe is used, it sets up a little click that registers on a listener, right? It might be a Wi-Fi access point, and it listens to that because it generated a small electrical signal that let off a tone. Imagine millions of these within a square mile. Like I said, it brings the city to life. It gives us a community of devices that have a voice. What are the enablers of these things? The other one that I was going to do was low latency. Low latency? It simply means timeliness. You get a response back quickly. Right? In communication networks, right? The light still travels through media, and so you have the speed of light or the speed of a photon through a fiber, right? To account for. But what if you wanted? And the propagation time is about the order of 0.6 milliseconds per 100 miles. So what if you needed a response, right, for some applications, right, for some assisted or virtual reality applications? You want to have a response to an action, right? I'm dealing with a virtual avatar here, right? It's generated, and I reach out to shake a hand. I want to be able to see my hand reached out to at the same time. It turns out that if there's more than a 20 millisecond lapse gap, it starts throwing you off. You don't measure it, you don't this, but it starts throwing you off, right? You see it if, for instance, let's say lip movements are not synchronized with the sound that you hear. That's an example of it. And so what we need to do in these is to be able to adjust the latency so that, in fact, when you have an application that's connected, all the connectivity is up there, right? You've got a connected vehicle that's approaching an intersection, needs some key information about that enables it to decide whether to turn right, left. Right? It sends a query out to the network. If that thing comes back a second later, because it had to go to a cloud database across the country because that's where the cloud provider was, right? Even though it's in the cloud, it's still physical infrastructure. Response time, latency is important, right? It has to do with timeliness of the response, right? So this enables us to be able to make much more pertinent use of those voices that these devices have. They come at the right time for us to be able to make a decision. And it turns out that why does the split second matter? It actually matters in a number of applications. In a smart, let's say, manufacturing situation, right? Essentially, you have a robot going about, and if you compare, you increase the latency. It turns out the robot can actually locate a particular point in the right time. So that if a robot has to go and, let's say, pick up a package, it'll be like a drunk trying to pick up the package, because it'll go up there and dither about and finally pick it up from the wrong end. And you need that response time, right? And we've been able to do this, right? Low latency. It happens with edge compute. What this means is that we've taken the compute that responds to the query and put it at the edge of the network, right? Almost right there, just behind the cell tower. It's right there. And the object is to have something like a 10, 20 millisecond response time, depending upon the application. Now, it turns out that edge compute doesn't have to do with wireless. It doesn't have anything to do with this, but it's part of the standard because it's a key enabler. And there are some strict guidelines and design considerations around how edge compute should work, right? And for which applications it's needed. In this case, it's needed for things like augmented reality, virtual reality. There's new spectrum as well. You've got higher bandwidths, new spectrum come along, and you've heard terms like sub-6 and 1 gig. And it turns out that spectrum is simply about transmittability of radio waves. And at really high frequencies, the low wavelength, they're really susceptible to interference. They don't have a lot of propagation. If you had a device that worked with millimeter wave, you'd hold it up, and if you had to hold it, it would stop working because your hand would be the obstruction. It can't make its way. So there are specific applications where you can use millimeter wave and you can use the kind of bandwidth because it's of the order of gigahertz of bandwidth and gigabits per second of data rate. You just need to be able to specialize on where you can do it. That's where things like small cells come in. A small cell is basically a transmitter, right, within the area of a city block. There's another one at the next intersection, another one at the next intersection. And so now it's got a short distance that it needs to propagate to talk to all the devices here. And guess what? You can connect 1 million devices to that one small cell. And on the next block, another 1 million devices. If everything is connected, everything is knowable, right? And what this will lead to is greater transparency. All our actions, the things we do, how we interact with our environment is eventually measurable. There'll be greater transparency in our activities. Right? There'll also be greater privacy, though, because the security protocols will step up to protect information that isn't for public consumption. We do it now in less automated, less rule-driven ways with things like medical records, and right? we keep information that is shareable, right? Yet private to those who really need it. And so those mechanisms are kind of addressed within the 5G protocols. And I'll close by saying that all of this happens, right? Data rates, the low latency, high device connectivity only matter if the network's up. If the dial tone is there, if this device or these million devices that have a voice can be heard. We do that, again, by looking at deployment scenarios. Like I said, the small cell, right, is the one that's most susceptible to interference and distance and rain and leaves and hands. And so we have very strict guidelines and rules and design considerations for where they deploy and how. Right. There are other mechanisms like multi-input, multi-output. Big advances, big steps forward in antenna technology that enable higher capacities. I could go on, but we can build smarter cities that will give us more visibility into the environment around us as we build more and more sensors that track and trace the environments we interact with. There will be greater transparency, greater productivity because we know more. Right? And because we've got edge compute, right? We've got compute just on the other side, helping us make sense of all of this, correlating all of this, giving the information to us in a timely way so we can act on it. Thank you.
Great, thank you, Osmond. That was a fantastic overview and kind of what's the appetite, I think, for everybody for exactly what some of the potential is for this new technology. So next up, Dr. Andres Kwasinski, who is a professor and graduate program director at the Department of Computer Engineering at RIT. Dr. Kwasinski has more than 20 years experience in telecom, started his career with AT&T and Lucent Technologies. Before joining RIT, was with the Wireless Information Group at Texas Instruments. He's co-authored more than 90 publications. I don't think I've read 90 publications, let alone authored 90 publications. Is currently an area editor for IEEE Signal Processing Magazine and chief editor of the IEEE Signal Processing Repository. So with that, Dr. Kwasinski, the floor is yours.
Yeah, thank you. So in planning for today's panel, I was trying to think of what is something I wanted to highlight of about 5G. I have been lucky enough to, my first job was to do installations of the first generation cellular networks. And so this time I have been seeing how the technology has evolved. And I wanted to start by talking a little bit about that, about what is this excitement about 5G and why we are all excited about talking about 5G. And the way that I like to present that is by quickly showing the evolution of the now 5 generations of cellular communications. And going back to the 80s, that's when we had the first generation, that is analog phones. Those are the ones that you remember, these big phones that essentially the technology is a FM radio. Okay, the same FM radio that you have in your cars. You use it at different frequencies, but technology was essentially that analog. Fast forward 10 years into the 90s, and that's when we have the first, second generation, but that's the first that use digital technology that allows phones to become smaller. And in terms of things that we gain from that, that's the first generation where we can start sending text messages. Okay, and then from there in the 2000s, we got to 3G. That's the generation where we started using the smartphones. Okay, that's when we started to access the web, do email, and essentially use our smartphones with the cellular network. Was also the one where we started to use the first selfies. Although you may remember that the first smartphones didn't have the camera for the selfie, right? Because they were not that famous yet. And then we get to the 2010s with the fourth generation, and that is the one that, as Olmo was mentioning, is the one that is IP-based. That means that all is just data, even voice. Voice is not intended to be sent as regular voice, but it's intended to be sent as data. And it's the one also that, technologically speaking, it presents quite a remarkable improvement from the third generation. It's the one that, for example, allows us to stream a sporting event live as we are driving, or someone else is driving. We are watching a sporting event, right? In real time. Technologically, when you know what is going behind the scenes, that is real achievement. But then, 10 years later, now to 2020, we go and we are up to the time for 5G. And what is that is so special about 5G? That is the first standard when people went and designed the standard that was designed around thinking about industries, being the healthcare, transportation, all many industries, but it was the design of the standard was with industries in mind, not only the general consumer that we are all are. And what does it mean? Well, what is new in 5G in this term? Well, there are a lot of things that are new there, but just to highlight a few important points, is that the standard is designed around three application segments. There is what we call the enhanced mobile broadband, or EMBB. Okay, that is essentially what is the improved version of what we have today with 4G. That's the one that is for consumers. It's the one that we hear in commercials when people talk about that we are going to be able to download a full-length movie in just seconds. Okay, that's the one. But there are two other application segments. There is one that's called massive machine type communication that is actually designed to respond to or work for the IoT devices, Internet of Things applications. It was almost talking about millions of devices connected with a square mile. That is what fits into that application segment. And then there's another one that is what we call ultra reliable or low latency communications, and that is intended for industrial applications, such as Industry 4.0 or autonomous vehicles and so on. What is interesting about these two application segments is that different from the other one that is for consumer, that is us, people, the other two are for things, for objects to communicate, maybe with people or maybe between themselves, to a cloud, to an edge, but is thinking about objects now becoming those end users as we have been for already 4 generations into the 5th generations. And in terms of what that means in terms of performance improvements, and Osmond mentioned those, I just giving here a number, but is improvements in data rate, 10 times from what we had before, improvements in delay in terms of reducing 10 times, okay, and that 1 millisecond that is there as a target, for us, it means nothing. We cannot perceive that, but it's intended thinking about industrial applications. Industrial applications, sometimes if you have a few milliseconds delay, it may mean that the process, an industrial process, becomes out of control. Okay? So we need sometimes to have very tight, very low delays to control industrial processes. And also in a large increase in connection density, number of connected devices, also mentioned about that. So with this big, large increase in data rate, also decrease in delay, now what we can do when we look at our own handheld devices, our smartphones, is that those devices, those smartphones can send a lot of data very quickly, not only in terms of delay, but low delay, but also in terms of amount of data it can send. And then what that allows is that that device doesn't need to now to compute or to do a lot of computations. It can offload a lot of the computation to another computer data center that is on the network. Okay, and it can do that so fast that for the end user, for us, we don't perceive that there is a real perceptible separation. It looks like our phone has the capabilities, the compute capability of a data center. Okay, if you take away the delay, it's like you're holding that data center, right? And you don't have any more that type of delay. So that is what we call an edge computing. And why is that? Is because to have that low delay, we need to bring those data centers closer to the phone, closer to the end user. Okay? And so what we have with edge computing is that we're going to have small and more distributed data centers that may be located pretty much on the premises of the network. It may be at the central office, it may be even at the base station, or in many cases, it may be also on the premises of the customer, an enterprise which will host that computing capability. And then that allows a number of applications. Almost mentioned a good bunch of them. Just to highlight what I have there in terms of, for example, thinking about transportation, intelligent transportation services. It enables autonomous vehicles. In the sense that autonomous vehicles can communicate to each other, can communicate to the road, can communicate with other people. People maybe not in a conscious way, but people holding phones, and then that increases safety on the road, right? But even you don't need even to think about autonomous vehicles. You can also have a good number of services for regular vehicles, right? I mean, if you think, for example, you may have a number of cameras or other sensors on a portion of the city, you can send all that video, all that sensing information to a edge data center and analyze that information quickly and send information about traffic conditions, road conditions to the drivers in a very quick way. And also not only quick way, but specific to a particular area, right? Very much personalized. I will also add, as I transition to other applications, that a lot of all these applications are also very close interlinked with another of the revolutions that we're having these days, that is artificial intelligence, right? A lot of these applications are powered also on the compute side of artificial intelligence. And what we need for that is many times process a large amount of data and also good computing capabilities. And that's why we are thinking about the edge to do that. Other application, industrial automation or Industry 4.0. Augmented reality, also mentioned that one. Retail, I mean, when with this type of application, what we can now think about is immersive retail experiences. You may have heard about, for example, the stores at Amazon, grocery stores that Amazon are opening up in different parts of the country. That essentially they are almost automated. There are not really any person on the registers. You go in. And as you are picking things from the shelves, you are automatically registered as being holding that, and then you just walk out and all is charged automatically, right? That is just the beginning. I mean, you may start thinking now, when you have the capabilities of sensing what is going on in a retail environment and sending that information to a computing facility and then sending it back to the end user, the possibilities are many. Okay, are really very. And the last one I want to mention is what is called the tactile internet, which is essentially it's a name for what is a seamless telepresence. Right now, with this low delay, large data rate, good computing capabilities, you can almost emulate the telepresence with as you are there. Okay, even with the sensory information that may be touching something, thinking about applications, for example, for telemedicine and so on. And that actually concludes what I wanted to highlight for you. Okay, I'm looking forward later to all our discussion.
Thank you very much, Andres. More great and interesting stuff. So our third presenter today is Al Cannell. Al is the founder and president of Strategic Interests. He and his firm work with health systems, health plans, practices, long-term care providers, and vendors, helping them create positive impacts through the innovative use of information technology. Al is a thought leader, community activist. He's active with associations such as the Healthcare Information Management Systems Society, Tech Rochester, their healthcare group. And I suspect, as we talk a little bit more about applications of 5G, healthcare might be one of the areas that you're focused on.
Hey.
All right, please welcome Al Cannell.
So, first of all, what do the prior speakers in marathons have in common? Not an easy question to answer. One, I will never know as much as these guys know about 5G, ever. I will never run a marathon. And I don't feel bad about either of those, right? We have plenty of people that do. But reality is, technology, it doesn't matter what kind of technology, will not come to fruition and will not be sustainable without applications that run on it and people that make those things. Applications will not be created and not be sustainable without real economic value, solving real problems that people have. So I'm going to bring to you some thoughts about how healthcare will be able to take advantage of this. And a lot of this are principles and fundamentals of how I think and how I learned a lot of that in consulting beforehand. But anybody here ever work at Xerox? Anybody ever work at Kodak? Anybody work at both? All right, I got a chance to work at both. Phenomenal places where there's amazing technology and pockets of brilliance. Applied those to help people solve problems. That's really what we're talking about here. So first, I'm going to take you through the problems that are going on, and this will be very quick because we want to get to the meat. But reality is, excuse me, my mother-in-law's calling me, so later. Reality is, healthcare cost is way untenable, unmanageable here in the United States. And just looking at a few things, we are by far the highest cost, and the cost is growing faster than ever imaginable. And it's still not even slowing down despite many efforts. So if you look at the very first column, that's the US, far more expensive than anybody else. You've probably seen this. What are we getting for it? Well, our mortality, we're not getting longevity. In fact, if you look at the US, we're way down low in terms of longevity compared to other countries. And our ranking in terms of care quality is very poor compared to the other developed nations. So spending more and getting less. Something called disease burden. So how much do we struggle with diseases? You'd think with all the technology we have would be great. No, we're not very good at all. So we have the highest disease burden of all the advanced nations, probably because of lifestyle and a lot of other factors. And then we have things of disparity. So people of race not getting health care. And so your zip code is probably the most important thing in terms of how healthy you are and where you are. Are you rural or are you urban? And those two sectors are struggling. And so being able to address urban health with telehealth is just one of the advantages of 5G. But if you're a public health policy guy and you want to improve the health of the United States, these are some of the problems you struggle with, right? Then we have the fact that we're getting older. Can't help that. In fact, I'd rather not help it. So more and more healthcare is going to be delivered in the home than it ever has in the past. And the percentage of baby boomers is just growing and growing and growing. So we're getting older and we're going to be shifting to the home. So that implies a different way of taking care of us in the future than we've had in the past. So let's not be set on the hospital mentality. So some of the trends, technology, and change in US healthcare that's going to be driving these applications. The financial situation is for a provider, for somebody who delivers care, they're getting less money for the things that they do. Their costs are going up. The penalties are increasing and the weighted average cost of capital is increasing. So it's hard to be a CFO in healthcare today. At the same time, there's efforts to shift from what's called fee for service, you're paid for what you do, to you're going to be paid for the results you get. That shift is taking a long time. Our city tends to be slower in that adoption than others, probably because we have the lowest Medicare costs in the country. That's very impressive. So there's a less of a need to bring that change here than elsewhere, but it's coming, it's going to happen. And lastly, there are initiatives of providers to increase share, to sell more units. If you're in the fee-for-service basis, just like any business, you want to sell more, increase the price, change the mix. So the mix says how many of your patients are Medicaid versus Medicare versus commercial versus private pay versus the people who don't even pay at all. What can you do to increase revenue, address cost, and supply chain? So that's the setting. Now you enter the technology that's shifting, the technology that's really going to provide a fundamental shift. You have the introduction of IoT. There's a phrase you may hear, IOMT. That's the Internet of Medical Things. There is interoperability, or being able to share clinical information far better than it's ever been shared before. This has been a problem in healthcare. You have a concept of beyond the EMR. So the electronic medical record, you may or may not know, has been problematic and a savior at the same time. So a lot of challenges, a lot of docs hate it, a lot of patients hate it, but it's also very good. So people are spending time now to optimize that big investment, address gaps in care for patients, and come up with actions to improve care. So how are you going to do that? A huge increase in analytics, both the traditional business intelligence and the use of AI. AI is really going to explode in healthcare. It will struggle for quite some time, but it will explode. Things like image-based AI is really ripe for that. And then comes the next one, which is very big, the convergence of these. So any one of these is not bad by itself, but you start having the ability to combine these different things where you reduce the latency, increase the power of edge computing, increase the speed, increase the number of people that have access. All of a sudden, you can do things with the convergence of these technologies that you couldn't do before. And so there's the business reasons up top of we need and want to change, and there are the capabilities that you have. So the result is change in how care is delivered. On the structural side, huge increase in M&A, rolling up, buying practices, hospitals buying each other, partnering, aligning, IPAs or independent physician associations, something called clinically integrated networks, and the way that providers contract with payers. Also, a major shift is out of the hospital. We're really trying to get healthcare out of the hospital to the home, to other facilities, because it's less costly and you can have more success, and people get sick in the hospital. Preventive measures, home-based care, ambulatory surgery centers instead of big in the hospital, and something called population health. It's really a combination of marketing and analytics and ability to identify gaps in care and close those gaps with interventions, population health. Then there is the whole plethora and explosion of patient engagement solutions, telehealth just being one, education another, virtual reality a third, and having access to information that you didn't have before as a patient and staying better connected. We'll get into some of those. Connectivity and transparency is important. People want to know what they're paying for in healthcare, how much it costs. Disintermediation, the disruptors, just like every other industry, we could have spent 10 minutes just on that. There are so many really huge examples of that, but it's phenomenal. You have Amazon going into healthcare. You have all kinds of changes coming. Then we have the social determinants of health. So that is going beyond clinical care. So going beyond the doctor, the specialist, and even the behavioral health therapist that helps you. But for those that are less fortunate, that have housing instability and have food instability and can't get to their doctor appointments, guess what? They're not going to get better clinically if they can't fix those issues. So now there's a tremendous effort to include the social determinants of health. So add all that up, and you can see on the right where hospital or where care is being provided is changing. How much is going to be monitoring is going to increase from 10 to 16%. How much is treatment is going to go down from 70 to 51. Prevention, so avoiding problems in the first place, significantly increasing. And then diagnosis, getting ability to better diagnose. So we all are aware of the shift in banking from the big bank to the regional bank to the ATM to home, right? Successful. I think it was pretty successful. We're still in that shift for healthcare, and it's going to go on for a while. So you have the emergency room or the hospital and the pharmacy, and now you have the ambulatory offices, you have kiosks that may show up at the facility to reduce the time and effort and labor to check you in. Then you have something here. Anybody know what this is? There's blood pressure and many other things. Higgy here in Wegmans, fully underutilized compared to what it could be. So we've been in conversations with them about how we might be able to really take advantage of the ability to connect with patients in advance. Then you have pills that come already set so you can take them at home to avoid med problems. The hospital at home is totally emerging. So being able to do monitoring and information at home, the estimated size of the home care market has a CAGR, compound annual growth rate, of over 10% from 2016 to 24. I mean, when private equity starts sniffing around the home health market, you know it's something. It used to be the dog of healthcare. Nobody wanted to touch it. And there'll be challenges associated with that because they'll try and beef up the revenues and make a lot of money, so the government will try and shut it down. So it's no free cake, or you can't eat your cake and have your cake and eat it too. Then there's the hospital of the future. We're lucky here in town, two great institutions. U of R does some great things. RH putting up their new tower with connected patient rooms, incredibly highly functional ORs that are going to take advantage of 5G and have fixed wireless capabilities to get those images that are taken inside the body and get them back to the surgeon so they know what to do instantaneously. Wayfinding, and there's always going to be all kinds of challenges to do so. So just two more. One, the applications, some of the applications that are really going to be driving in healthcare. I'd love to work with AT&T to see some of these come to fruition. Some of your customers are going to just make this happen. I learned at Xerox, the best thing to do is not tell customers what to do, but listen to them and help them do what they want to do. And I was really successful in helping applications around the world of Xerox come to life and share it with other customers. But on two separate aspects, patient engagement in the hospital at home is one big, huge change, one trend that is going to have remote monitoring of the vitals, med adherence, the environment, telehealth, and get access to the clinicians. Connect that to the portals and the open notes and the messaging so your docs can be connected to it. Provide patient education so they really know how to take your patients. Do not know what to do when they leave and the doc goes through with them what to do. It's just hard. It's hard to remember all that. And then there's the less sexy, but the admin, scheduling, wayfinding, pay your bills, all those things are important. And they'll increase now because of that. So more applications will go to to a wireless device, and they'll be more successful as a result of 5G. And clinical trials, aware, you know what that is? The awareness, the willingness, and the ability to participate in clinical trials. People don't want to do trials because they don't want to drive 2.5 hours for an appointment every 3 weeks. Well, if they can do some of the appointments at home, maybe they'll participate in trials, or maybe they'll stay longer, or maybe they'll stay on the meds longer because the side effects are being monitored by somebody at the provider office. Then on the clinical provider side, AI will explode. It's just a question of where and how to pull it in. Device integration, absolutely huge. Telehealth, video, and the ancillaries that go with it. So being able to provide a whole bunch of images to the clinician so they can see what's going on your body and in your body, like never before. Ultrasounds on your cell phone, et cetera. Personalized medicine is a huge, in order to do personalized medicine, you have to have incredible amounts of compute power and access to data that can be useful with some AI algorithms that can figure out what's the best care for you. Patient-generated health data from devices, robotic surgeries, and then including some patient-reported outcomes. U of R is really leading the way with some NIH programs in that regard. So it's just some idea of kinds of applications that will take off when 5G gets here. Also will encourage more hospitals to want to, embrace 5G and health systems as well. But last slide, just beware, it's no simple task, because without access to clean data, meaningful data that's been normalized and useful, this all falls apart. So we still haven't solved the problems we said we were going to solve years ago. It's a lot better than it was, but it comes with implementing EHRs, and George knows a lot of this, as a foundation, connecting them so we can have a comprehensive record of Al Canal, no matter where he's been, here, Florida, wherever. Then putting in the tools for care management and population health and the patient engagement. And then you get to be able to provide some of those business benefits. So it's a long road to hoe, but I look forward to continuing this journey, and enabled by these very smart guys who know 5G.
Thank you. At this point, I'd like to invite our speakers up, grab a chair, and we will open it up for Q&A from the audience. We started a little late, we're a little behind schedule, but we're gonna take some questions for a few minutes here. So anybody want to go first? Yes.
So we should talk. I'm part of the Remake program, and squarely building a bunch of bioanalytical tools to enable distributed healthcare. So we're dead on it. But the questions I have are around data security. That's probably the big one. It's more standardization. Is anybody heading towards a standard for encryption? I'll just leave it.
So with regards to patient data,
The electronic health record.
the electronic health record, there are two models emerging. One is to anonymize the data, and the other is to produce synthetic data that actually looks like that data. We have one such company that does that here in town, believe it or not, Exact Data, who grew up doing this out of doing census for the US federal government. And then there's some very innovative companies, one I know out of Israel that's working with a lot of top tier institutions to not have to transform the data so that it can be transformed back, but rather to create the data that actually looks like the real data, but is not. So you can use it in an unlimited way. But not an easy problem. And we have our own local Rio here who is making data available for secondary use, but it's far limited in terms of the scope of the data that you would want. So look forward to conversations. I know Sujatha, and we'll just have fun with that.
Husband and Andres, is there anything in the 5G protocols, or since there's so much data and so many connected devices, regarding security or encryption or anything like that?
So again, 5G itself isn't just a communication protocol. It's a communication ecosystem that involves things like edge compute. And in this case, even though it's not part of the 5G standard, blockchain is used to be able to verify and authenticate and make tamper-proof, or at least tamper detectability in records that end up going through multiple hands, that end up being modified over time, but still current. You can go back and verify the chain of events and the chain of additions in this. And it is blockchain itself is a fairly, let's say, common implementation now. There are a number of providers that have blockchain implementations, and actual use cases in business, in retail, in manufacturing, healthcare are emerging all the time. It's just a question of having the right infrastructure and the right authority set up to make this happen.
Yes, Richard?
Yeah, what can you tell us about the timing for availability of the 5G and the other networking?
So it depends on the geography, on the provider. Happily, in Rochester, AT&T has a 5G deployment available for both consumers and businesses since like the 10th of December. There's a phased rollout, right? Clearly, there's infrastructure that needs to be put out. And, there is a phased rollout. There was an initial deployment of about 15 cities, and then another 19 were added. And the intent is to have basically all of the states wired up for both segments of the bandwidth chunks that they have. So that's millimeter wave, right, for really high speeds, and sub-6 and 1 gig for lower speeds, but more reliability in the data transmission itself. But to have it wired across the nation by the end of this year.
Yeah.
Hi, I'm trying to get my head around some edge computing issues. So the small cells will be required, so there's more of them, they're smaller. Now they have edge computing, that's correct. So we're packing huge amounts of computers in the little neighborhood boxes. Is that how this is gonna work? So I wonder how that's gonna work, because you need a rack, server level compute power. But a bigger question is, if I'm developing an app and I want to use the edge computing, I need a complete service stack on that edge compute. Like in the cloud, I can develop a REST API and deploy it, and I can answer requests. Now the infrastructure has to not only allow me to do that, but send it out to every small cell station in the world, because I can only compute at the edge. So am I wrong, or are people thinking about how to manage this? And can a developer even deploy a service to the edge, or is it just going to be generic services?
What's that?
I'll take a stab at that. So in this case, edge compute ends up being spatially relevant, right? We use edge compute. For instance, you talked about the small cell deployment. The reason we have small cells is because if you have 1 million devices to connect, you have to have enough base stations to be able to aggregate that. And so now you need to put base stations every block or every couple of blocks so that all of them can come in there. Now, the edge compute doesn't necessarily have to be sitting right behind the base station. It just depends upon the application. And so we might have edge compute, let's say, I hesitate to call them slices, but it turns out that the devices that we have, first of all, they're highly efficient in terms of the number of applications they can support. They're the size of about a pizza box, right? And so, and the applications that we have that talk with, say, the intelligent devices or the connected vehicles themselves, have a fair amount of the information that is local to that geography. Each particular application that requires the appropriate timeliness, right, will be designed to operate within a given geography. So we've got our work cut out for us in terms of figuring out what is the optimal deployment of edge compute in what kind of infrastructure, depending upon the kinds of information that is needed and what decisions it drives.
Yeah, and I will add to that something that may help you understand how your questions have been answered in terms of technology evolution is to look back and see that edge computing, in a way, is an evolution from what we call content delivery networks. And those are networks that are used by services that have volume of traffic, video streaming. And what they do is they push the traffic to the edge of the network, and it's stored on a temporal basis closer to the edge, so we don't have to retrieve that video stream all the way from the root, but closer from to the end user. The same idea is what's happening with edge computing. It's only that in addition to storage, now what we are adding is computing capability.
Let's bounce over to this side of the room, Samuel.
Today, at least 3 distinct frequencies are used for 5G data transmission by different providers. And these, low wavelength, mid wavelength, and long wavelength have different spatial reach and also different data rates. And also there are system connectivity issues. Do you know if one of them is going to be winner or they are going to coexist?
One of the providers or one of the
By the
bandwidth?
providers, since they're also building infrastructure around these, long, short, and medium wavelengths. So
Okay.
how it is going to turn out?
So we can look at, say, the FCC auctions of spectrum. And you're right, it's not evenly distributed, but the fact is that the 3-4 major carriers in the US have spectrum to go around, right? And their coverage, if you want to rely on past experience, the situation has been the same with, let's say, previous allocations and auctions of bandwidth, right? It happens that those with the resources end up with slightly larger shares of it, but the FCC kind of makes sure that you don't get more than all of it. You don't get all of it or close to all of it. So they have been able to find a way to get AT&T and Verizon and Sprint and T-Mobile and a bunch of other smaller players some amount of, let's say, what they would consider equitable access to the bandwidth. Right.
So my
Now
question was, if you go to IoT, down the road, when you are connecting more devices, we are talking about automated hospitals and automated
Yes.
homes and automated manufacturing. There are system connectivity issues among the 3, these distinct wavelengths. How is that going to be done well?
So the sensors that are out there listening and talking, if there's different bandwidths and different frequency ranges across all these different 5G systems, are they all going to be able to work and talk to the network and be useful? Yes.
Right. So it turns out a fact of life today is that if a device is talking, it's talking to one particular provider. You have a SIM. Now we're not going to have SIMs on every sensor, but we're going to have kind of the equivalent
So it'll be a sensor tied to a particular.
of necessity, unless you want to find a way to have 2 providers for redundancy, right? But in that case, you basically have to have 2 sets of antennas. I'm thinking.
Now, we have a lot of hands in the air, so we're going to try to make these fast questions and fast answers. So I think you better do something wrong.
Can you speak to the health concerns specifically around cancer and changes to DNA and bacteria growth that have been written about with regard to 5G?
You mean more G or 3G?
Yes, specifically to 5G.
I don't know anything about it.
So I'm not qualified to address those. I'll just make this observation, and that is that the actual power used by, let's say, the base stations or the cell towers or the macro cells are small compared to small based on the distance and proximity to an affected person compared to the phone you hold to your head when you're talking. Right? They're low power. Now, I'm not making an assertion that low power is better than high power or how much better, right? But as a society, as a community of users, we've kind of accepted the risks. And I'm not saying they've necessarily been completely uniformly informed or not.
I could give you just
But
a
we have-
quick answer to that. The electric power flux on human beings by far is greatest from the electric wiring your house, electricity in your house. Not that there is not a potential for problems in that direction, but it's an antenna function. And, that's what you need to watch for. And there is going to be some pretty exciting stuff with brain stimulation with various wavelengths of various radiant energies, but there's no credible evidence
and
that
I-
5G is worse than.
So I'm going to start by saying I'm not an expert, far from an expert on this field, but I was doing some reading recently on that. And what I learned from that is that there are two types of radiation. One is called ionizing and what is called non-ionizing. The one that is cancerogen is the one that is ionizing. And the one that we use for wireless is non-ionizing.
Very good. All the way to the back. Yes.
Chief, if you could just go through each one of you, we've been talking about Internet of Things, I've worked with Cisco Systems for years, I know all of the wonderful things that are coming, but I hate to be a Debbie Downer, but I would love to hear your opinion on what's the biggest concern. Who are the thought leaders, are we gonna get it right or wrong, and you can choose an industry, because I know talking to executives in healthcare, using AI and using the data can be mishandled and can be it's not a rosy picture like they thought it would be. So there are some concerns on 5G, on security issues, but just what are the top things in your mind from we gotta get this right, or what's my biggest concern
Yeah.
and how we roll this out?
I'll take AI out because that is a separate set of issues, and there's AI layering on top of IoT. But IoT, it would be security. So you have a plethora of devices that, if not properly monitored, could provide a potential for a bad actor to get in the network. Now, there are AI emerging solutions to defend against that work quite well, but putting in a plethora of IoT without the proper securities could be problematic.
Yeah, I will complement that by saying that in terms of security, hacking into the wireless network by hacking through the actual transmission is a pretty difficult thing to do. Now, generally speaking, people tend to think that is not as difficult as it is, and that is going back to my slide on the generations. And that is because going back to the first generation, it didn't require anything to tap into a code. You only need an FM tuner that your radio in your car that you can just tap into that frequencies. It was just that easy. But once in the second generation it became a digital signal, it became a lot more difficult to hack into that. But the problem is what we are talking here with the end devices. And now you can hack into the network through the end devices. And with IoT, what you have many devices, very different, very heterogeneous connection. And some are very secure, some you don't know where they're coming from and how they are. And those are the really challenging ones.
Okay, we're gonna take 5 more minutes of questions, so we'll keep going rapidly. In the back, you've had your hand up. Yes. Yes, you.
So it seems like we're really focused a lot on the problems. I'd like to know if you are aware of any places that have successfully implemented these. Is there an infrastructure set up? Is there a city? Is there a place? Is there something we can look at and say, these are the people who are doing it, and we can take a look and see?
Did you hear the
I
question?
didn't hear all of it.
So basically, are there any examples of communities or regions or places that have already successfully implemented a 5G implementation with an application that's
Already, no, but Chris was sharing with me that one large, very notable Midwestern hospital is about to do that and to be that pilot and prototype to get all the challenges out of the way so we can all move forward. I don't know of any health systems that have done that in the US.
Or in the world, it doesn't have to be just.
Yeah.
I couldn't speak about the rest of the world, right? But and in fact, AT&T, we have been kind of ramping up our 5G capabilities, not with first swoop deployment. We've kind of adjusted our network so that it's software upgradable, so that when the right time came, we could put in the right 5G software. We started doing that late last year, and we've completed it in 19 cities. So it's growing. And as it's growing, the availability is growing. However, subscribers still need to sign on, and that's been growing. But we're getting there. We might have this discussion, let's say, in another 6 months. And there's a bunch of people whose contracts will have run out, and they'll re-up with 5G. We'll talk then.
So not now.
So,
Yes.
a little too early, so.
Not yet for us to be able to make anything more than a very pointed statement. We've got a number of people who have kind of worked with us, because clearly they're not going to jump into this with both feet, right? So it's still in the earlier stages, right? But we're getting there quickly.
Right up here?
Yes, so there's been rumors that with 5G and the high frequency, it's very bad at penetrating buildings. Also, with millions of devices, is this a total IP6 network now? Or that's it?
Okay, so the first part of it, it's not a rumor, it's actually a fact now, because millimeter wave doesn't have the robust propagation capabilities of the sub-6 and certainly the 1 gig, of 1 gig. And so we've got to choose our deployment and let's say spatial use of millimeter wave for the Internet of Things. Like I said, we use millimeter wave mostly for, in this case, the easy one is small cell deployments. Right? Put it on a city block. It's got a low power. It connects to millions of devices around it. In retail stores, on the streets, in utilities, everything is connected. Right?
So it's how you kind of drop down in office buildings.
Yes,
Okay.
yes.
Yeah, but you have techniques also to help on that, like MIMO multiple input, multiple output that Osman was mentioning, is that you are, with the sophisticated antennas, you have the capability of directing your beam to specific locations, and that improves the signal quality. But also, what you can do is have very small cells, so for example, on different floors of the building, and then as you are going from one floor to the other, you are switching from one to the other.
Okay, 2 minutes left. Yes.
Okay, I really loved your point about how insulated our community is. I'd like an answer from each of you. On a scale of 1 to 10, how important is blockchain as a core competence for our region? 1 being not valuable or not essential, and 10 being like we have to get really good at understanding it and use the technology.
From my perspective, industry by industry will adopt. Healthcare will be slow because so many of the trading partners have to be in for it to be effective. But for manufacturing, it's the EDI on steroids, and we are still a manufacturing-based economy. So I think it will be a positive.
Okay. So manufacturing number and then general number. I hope you're
A 1 to 10.
Yeah.
Value 6 or 7 for manufacturing, a 2 for healthcare.
Got it.
Yeah, I'm not so much familiar on healthcare, but on manufacturing, I'm actually using blockchain on the project, and I will put it on the 7.
7?
Right. And for businesses and entities that have transactional records to keep verifying, supply chain is an ideal, right?
So supply chain.
10.
Okay,
10.
thank you.
All right, we got time for one last question right here. And there'll be time to network when we're done.
Yeah, so my students side do a lot of research at U of R on AR/VR, and things like that. And so we're very excited about integrating 5G into these applications. And it was great to hear that you said AT&T has deployed some sort of basic infrastructure here. And so I was wondering, like my practical question is, if you are interested in sort of evaluating AR/VR and autonomous vehicles in the 5G setup, is there, like how can we get engaged, and is there basic infrastructure that we can really do experiments with from sort of the research and the university setup?
Good question. I'm not sure I have an answer for you now, right? But let's exchange contact information.
Okay, yeah.
Chris, we can follow up on this. By the way, can we give a shout out to Chris Kaysen? He is a peer of mine. We do the same job, more or less. Chris does it with a lot more panache. But he's right here. He's local in Rochester.
Okay, Okay, we're gonna cut the questions off, although I see there's still more. I have a couple of quick announcements. Announcement number one, some people have asked for a tour of the incubator. And so Kate in the back has graciously agreed to do that. So if you're interested in that, be right out the door as soon as we're done here. Second announcement is that next Friday, for those interested in hardware startup companies, we have a hardware challenge event where companies can pitch. If they win, they get to go on to Pittsburgh and some other things to win prizes. So I think it's 1 o'clock next Friday. Anyone interested in hearing some hardware startup companies give a pitch, that's open and available. So with that, I think that'll call us to a close. Feel free to stay and network afterwards, but please join me in thanking our fantastic panelists. Thanks for coming.
Yes, there were a lot of questions.